Part B. In this part of the test, you'll hear different extracts. You'll have time to read each question before you listen. Now look at question 31. You hear a doctor talking to a nurse called Mihiraa. Now read the question. Mihiraa, have you been following the news about the Nipah virus outbreak?
Yes, it's concerning. The case fatality rate seems quite high.
It's a serious virus with a significant mortality rate. It's primarily zoonotic, transmitted through contact with infected pigs or their secretions. Human-to-human transmission is also possible, especially in healthcare settings.
Are there any specific preventive measures for healthcare workers?
Strict adherence to standard precautions is crucial. Wearing appropriate personal protective equipment, including gloves, gowns, masks, and eye protection, is essential. Proper hand hygiene and disinfection of surfaces are also vital. Mihiraa, it's essential to maintain a high index of suspicion for Nipah virus infections, especially in patients presenting with fever, headache, and respiratory symptoms.
What about treatment options for Nipah virus infection?
Currently, there's no specific antiviral treatment for the Nipah virus. Supportive care, including fluid management and management of complications, is the mainstay of treatment. Early recognition and isolation of infected individuals are crucial to prevent further transmission. Now look at question 32. You hear a nurse talking to a colleague called Mihiraa. Now read the question.
Mihiraa, how did your shift go today? Anything unusual happens?
It was pretty hectic. We had a few admissions, including a patient with acute chest pain. We managed to stabilize him, but it was a bit stressful.
That sounds like a challenging shift. How did the new staff member handle the workload?
Not too bad. They seem to be adapting well, but they could use a bit more training on certain procedures.
That's good to hear. Remember to offer support and guidance to the new staff. It can be overwhelming at first.
I will. Speaking of new staff, I'm wondering if we'll be getting any additional nurses to cover the increased workload.
Mihiraa, I've heard they're working on it, but it might take a few weeks. In the meantime, we'll need to prioritize our tasks and be efficient with our time.
I'm worried about patient satisfaction if we're stretched too thin.
It's important to communicate with patients and explain any delays. Transparency can help build trust and understanding.
Now look at question 33. You hear a nursing manager, Mihiraa, talking to hospital management. Now read the question.
Good morning, management team. I'd like to discuss a new method for improving patient satisfaction and reducing hospital-acquired infections.
Please go ahead, Mihiraa. We're always open to new ideas.
I've been researching the implementation of a comprehensive hand hygiene program. This involves promoting hand washing among healthcare workers and patients, providing adequate hand hygiene facilities, and conducting regular audits to ensure compliance.
That's a valuable initiative. How do you envision implementing this program?
We can start by conducting a baseline assessment of current hand hygiene practices. This will help us identify areas for improvement. We can then implement educational programs for healthcare workers, including workshops and reminders about hand hygiene techniques. Additionally, we can provide clear signage and hand sanitizer dispensers throughout the hospital.
What are the potential benefits of such a program, Mihiraa?
Improved patient satisfaction, reduced hospital-acquired infections, and enhanced staff morale. By prioritizing hand hygiene, we can create a safer environment for patients and staff.
That sounds promising. We'll discuss this further with the relevant departments and consider allocating resources for the implementation of this program.
Now look at question 34. You hear a nurse called Mihiraa training junior nurses. Now read the question.
Nurses, today we're going to discuss the importance of effective communication in patient care. Clear and concise communication is essential for building trust with patients and ensuring their well-being. It's crucial to listen actively to patients' concerns and respond empathetically.
I agree, but sometimes patients can be difficult to understand, Mihiraa, especially those with language barriers or cognitive impairments.
That's true. In those situations, it's important to use simple language and avoid medical jargon. Visual aids, such as pictures or diagrams, can also be helpful.
What about patients who are in pain or distressed, Mihiraa? How do we communicate effectively with them?
Patience and understanding are key. Validate their feelings and let them know you're there to help. Sometimes, nonverbal communication, like a gentle touch or a reassuring smile, can be more powerful than words.
I also worry about documenting patient interactions accurately. It can be time-consuming.
Accurate documentation is crucial for continuity of care and legal purposes. It's important to be concise and clear in your notes. Using standardized charting formats can help streamline the process.
What if a patient refuses treatment or medication? How do we handle those situations, Mihiraa?
It's important to respect a patient's autonomy and right to refuse treatment. However, we must also ensure their safety and well-being. Document the patient's refusal and inform the physician for further evaluation.
Now look at question 35. You hear a GP talking to a nurse called Mihiraa. Now read the question.
Mihiraa, have you been following the progress of the new COVID-19 vaccine trial?
Yes, Dr. Frank. It seems promising. The initial results suggest a high efficacy rate.
That's great news. Once it's approved, we need to develop a plan for its distribution and administration in our practice. We should consider factors like patient demographics, risk groups, and availability of resources.
We'll need to ensure we have enough staff and supplies to handle the demand. We should also communicate effectively with our patients about the benefits and risks of the vaccine.
Absolutely, Mihiraa. We should schedule patient education sessions to address any concerns and provide accurate information. It's important to build trust and encourage vaccine uptake.
I've already started compiling a list of patients who are eligible for the vaccine based on their medical history and risk factors.
Excellent. We should also prioritize healthcare workers and individuals in high-risk groups. We need to be prepared to manage any adverse reactions that may occur.
I've reviewed our protocols for managing adverse reactions. We should ensure we have appropriate medications and facilities in place. Now look at question 36. You hear two nurses talking at the end of the shift. Now read the question.
Mihiraa, how did your shift go today? Anything unusual happens?
It was pretty routine. We had a few admissions, but nothing too serious. Oh, and there was that one patient in room 203. She was quite agitated and refused her medication.
Really? That's unusual. Did you try talking to her and finding out why she's reluctant?
Yes, I did. She mentioned having a bad experience with medication in the past. She's worried about side effects and feels like she's losing control.
That's understandable, Mihiraa. It's important to address her concerns and build trust. Perhaps we could involve the social worker or a psychiatrist to help her manage her anxiety.
That's a good idea. I'll bring it up with the team leader. I also noticed that the supply of 4 fluids is running low. We might need to order more for tomorrow.
Great. I'll take care of that. Remember, we need to be extra vigilant with patient care, especially during busy times. Let's make sure we're not missing anything important.
Now look at question 37. You hear a nursing manager called Mihiraa conducting a team meeting. Now read the question.
Team, I'm excited to introduce our new trash carts. These innovative carts are designed to improve waste management efficiency and reduce the risk of injuries. They feature a hands-free mechanism, making it easier to dispose of waste without direct contact.
That sounds great. How does the hands-free mechanism work, Mihiraa?
It uses a sensor that detects when the cart is near a trash bin. The lid automatically opens, allowing you to dispose of waste without touching it.
That's fantastic. This will definitely help prevent the spread of germs and reduce the risk of infections.
Exactly. We've also incorporated a larger capacity to minimize the frequency of emptying. This will save time and effort for our staff.
I'm concerned about the durability of these carts. Mihiraa, will they be able to withstand heavy use?
The carts are made from sturdy materials and are designed to be durable. We'll monitor their performance and make any necessary adjustments.
Now look at question 38. You hear a care home manager called Mihiraa talking to a newly admitted patient's GP. Now read the question.
Dr. Paul, thank you for referring Mr. George to our care home. We've reviewed his medical history and medication list. I have a few questions about his medications.
Please go ahead, Mihiraa.
George is currently taking a combination of medications for his heart condition and diabetes. I noticed that he's also taking over-the-counter pain relievers. Is there a specific reason for this?
He's been experiencing some discomfort in his joints lately. I recommended over-the-counter pain relief as a temporary measure.
I see. We'll monitor his medication closely and ensure there are no interactions. It's important to avoid unnecessary medications, especially in older patients.
Absolutely. I'll review his medication regimen and make any necessary adjustments.
Also, I noticed that George is taking a blood thinner. We'll need to be cautious about any potential bleeding risks, especially during minor procedures.
Thank you for bringing that up. We'll provide detailed instructions to the care staff regarding his medication and any precautions necessary.
Now look at question 39. You hear a GP called Mihiraa talking to the staff in the clinic. Now read the question.
Team, I'm excited to introduce our new token system for patient appointments. This system aims to improve efficiency and reduce wait times for our patients.
How does the new system work, Dr. Mihiraa?
Patients will receive a numbered token upon arrival. The tokens will be displayed on a screen, and patients can wait in the designated area until their number is called. This will help us manage the patient flow more effectively.
Will this system eliminate wait times completely?
While we can't guarantee zero wait times, the token system should significantly reduce them. It will help us prioritize patients based on their appointment times and medical needs.
Dr. Mihiraa, what happens if a patient arrives late for their appointment?
We'll have a policy in place for late arrivals. Patients who are significantly late may need to reschedule their appointments. However, we'll try to accommodate them if possible.
Now look at question 40. You hear a head nurse called Mihiraa talking to a staff nurse. Now read the question.
Nurses, it's important to emphasize the consequences of taking uninformed leave. While we understand the need for time off, it's crucial to follow the proper procedures to ensure adequate staffing levels and patient care.
I understand, Mihiraa, but sometimes unexpected situations arise that require last-minute leave.
That's true. However, it's essential to notify your supervisor as soon as possible. This allows us to plan and adjust staffing accordingly.
What are the consequences of taking leave without informing the supervisor?
It can lead to staffing shortages, which can impact patient care quality. It can also result in disciplinary action, including written warnings or suspension.
Can we take leave if we're feeling unwell?
Can we take leave if we're feeling unwell?
Now look at question 41. You hear a dentist called Mihiraa talking to a surgeon. Now read the question.
Dr. Paul, I'm concerned about Mr. Gill's recovery following the recent jaw surgery. He's been experiencing significant pain and swelling.
Yes, Mihiraa, that's not uncommon after such a procedure. The swelling is likely due to inflammation. It should subside over time.
Yes, Mihiraa, that's not uncommon after such a procedure. The swelling is likely due to inflammation. It should subside over time.
That's a valid concern. We'll need to monitor his bite and make any necessary adjustments to his dental restorations.
Additionally, I'm concerned about the risk of infection. Given the location of the surgery, there's a higher risk of oral bacteria entering the wound.
Absolutely, Mihiraa. We've prescribed antibiotics to prevent infection. It's important for Gil to follow the medication regimen carefully and maintain good oral hygiene.
I'll ensure he's aware of the importance of postoperative care and provide him with specific instructions.
Now look at question 42. You hear a nurse called Mihiraa talking to a physiotherapist. Now read the question.
Evan, I'm concerned about Mr. Paul's progress after the knee replacement surgery. He's having difficulty walking without assistance.
Yes, Mihiraa, it's normal for there to be some mobility limitations initially. But we need to assess if there are any underlying factors hindering his recovery.
I've noticed he seems a bit hesitant to put weight on his knee. Is he experiencing any pain or discomfort?
Let's check his wound and see if there's any inflammation or infection. Sometimes, these factors can limit mobility.
He mentioned feeling a bit dizzy when standing up. Could that be related to his medications?
It's possible, Mihiraa. We should review his medication list and see if there are any side effects that could cause dizziness.
I'll inform the doctor about his symptoms. In the meantime, we can focus on strengthening his leg muscles and improving his balance.
That's a good plan. We can start with gentle exercises and gradually increase the intensity as he improves.
Now look at question 43. You hear a nurse called Mihiraa talking to a patient. Now read the question. Mr. Paul, how are you feeling today after the surgery?
A bit sore, but I'm managing.
That's good to hear. It's important to follow your doctor's instructions regarding pain management. Are you taking your pain medication as prescribed?
Yes, Mihiraa, I am. But it doesn't seem to be helping much.
We can adjust your medication if necessary. Let me know if the pain worsens. In the meantime, it's important to keep the incision clean and dry. Avoid touching or rubbing it.
I'll be careful. When can I start moving around?
Your doctor will provide specific instructions. Generally, you'll start with gentle walking and gradually increase your activity level. It's important to stay hydrated and avoid prolonged sitting or standing. We'll also monitor you for any signs of swelling or tenderness in your legs, which could indicate deep vein thrombosis.
I'm also worried, Mihiraa. My aunt had one after her surgery.
DVT is a common concern after surgery. We'll take steps to prevent it, such as using compression stockings and encouraging movement. It's essential to follow these recommendations and report any changes in your symptoms.
Now look at question 44. You hear a nursing manager called Mihiraa talking to a staff nurse. Now read the question.
Nurse Paul, I'd like to discuss a staffing adjustment. We're experiencing a high workload in the medical ward, and I believe it would be beneficial to reassign one of your patients to a junior nurse for additional training and support.
I understand, Mihiraa. However, I'm concerned about the impact on patient care. I already have a heavy patient load, and I want to ensure that all my patients receive the best possible care.
We'll carefully consider the patient's needs and the junior nurse's capabilities to ensure a smooth transition. We can discuss potential strategies to distribute the workload more equitably.
That's good to hear. Who are you considering reassigning?
Mr. George, a stable patient with chronic heart failure, is a good candidate. I believe he would benefit from the additional attention and support from a junior nurse.
I see. Mr. George is a stable patient. I'll be happy to help with the transition, Mihiraa. However, I want to make sure that the junior nurse is adequately trained and supervised to ensure the highest quality of care for Mr. George.
Absolutely. We'll provide the junior nurse with comprehensive training and ongoing supervision. We'll also closely monitor Mr. George's condition to ensure there are no adverse effects. Now look at question 45. You hear a doctor called Mihiraa talking to the chief of surgeons. Now read the question. Dr. Paul, I'm excited to discuss the potential implementation of a new surgical robot in our department. This advanced technology can enhance precision and reduce surgical trauma.
That's promising, Dr. Mihiraa. However, we need to carefully consider the costs and benefits before making a decision.
I understand. The initial investment is significant, but the long-term benefits can outweigh the costs. This technology can improve patient outcomes, reduce recovery times, and potentially reduce the need for invasive surgeries.
That's true. But we also need to consider the training and support required to operate this new technology.
We've already conducted a feasibility study and identified the necessary training programs for our surgical team. We'll also need to ensure that our infrastructure is compatible with the new technology.
That's important. We should also consider the potential impact on our staff, Dr. Mihiraa. Some surgeons might be resistant to adopting new technology.
We'll address any concerns and provide adequate support to our team. The benefits of this technology outweigh the challenges, and it aligns with our goal of providing the best possible care to our patients.
Now look at question 46. You hear a cardiologist called Mihiraa talking to a staff nurse. Now read the question.
Nurse Paul, I'm concerned about Mr. George's recent echocardiogram. There seems to be a worsening of his heart condition.
I'm sorry to hear that, Dr. Mihiraa. Have you discussed this with Mr. George?
Not yet. I want to gather more information before talking to him. I'm considering increasing his medication dosage to manage the progression of his heart failure.
That might be necessary. However, we need to monitor for any potential side effects of the increased medication.
Absolutely. We'll monitor his vital signs closely and adjust the dosage as needed. I also want to discuss lifestyle modifications with him. Regular exercise and a healthy diet can significantly improve his heart health.
That's a good idea. I can schedule a session with the cardiac rehabilitation team to provide him with personalized guidance, Dr. Mihiraa.
Thank you. It's important to involve Mr. George in his care plan. He needs to understand the importance of lifestyle changes and medication adherence.
Now look at question 47. You hear a surgeon called Mihiraa talking to the team. Now read the question.
Team, we're about to begin a complex surgical procedure. It's crucial that we all remain focused and follow the established protocols.
We're ready, Dr. Mihiraa. We've reviewed the patient's chart and prepared the operating room.
Excellent. Remember, this patient has a history of allergies to certain medications. Please double-check the medication chart before administering anything.
I'll ensure that the medications are verified. We should also have a backup plan in case of any unexpected reactions.
That's a good point. We need to anticipate potential complications and be prepared to respond accordingly.
What about the patient's blood type? We need to ensure we have the correct blood products available.
Yes, please verify the blood type with the blood bank. We'll need to have blood products ready in case of significant blood loss.
I'll double-check the patient's medical history for any previous surgical procedures or complications, Dr. Mihiraa.
Great. Remember, our goal is to provide the best possible care for this patient. Let's work together as a team to ensure a successful outcome. Now look at question 48. You hear a dietitian called Mihiraa giving a class to nurses. Now read the question. Nurses, it's important to prioritize your own well-being to provide the best possible care to our patients. That includes maintaining a healthy diet and staying hydrated.
I know, Mihiraa, but it's hard to find time to eat properly when we're so busy.
I understand. Try to pack healthy snacks and meals to have on hand. Even small changes, like replacing sugary drinks with water, can make a big difference.
I'm worried about gaining weight due to stress eating.
Stress eating is common, but it's important to find healthy ways to manage stress. Try incorporating relaxation techniques like yoga or meditation into your routine.
I'm not sure what to eat to stay healthy and energized, Mihiraa.
A balanced diet with plenty of fruits, vegetables, whole grains, and lean protein is essential. Avoid processed foods and sugary drinks. Now look at question 49. You hear a charge nurse called Mihiraa talking to nurses. Now read the question. Nurses, I'm excited to introduce our new fleet of wheelchairs. These advanced models are designed to enhance patient comfort and mobility. They feature adjustable features, ergonomic seating, and improved maneuverability.
That sounds great. How do these new wheelchairs compare to the ones we currently have?
The new models offer superior comfort and support, reducing the risk of pressure sores and discomfort during extended use. They also have a more intuitive design, making them easier for patients to operate independently.
That's fantastic. Will this improve patient satisfaction?
Absolutely. By providing patients with more comfortable and functional wheelchairs, we can enhance their overall experience and improve their quality of life.
Are there any specific features that we should be aware of?
Some of the new wheelchairs have built-in features like cup holders, storage compartments, and even lighting for nighttime use. It's important to familiarize ourselves with these features to ensure patients are using them to their full potential.
Now look at question 50. You hear a doctor called Mihiraa talking to a charge nurse. Now read the question.
Nurse Paul, I'd like to discuss the possibility of conducting a lecture session for the nursing staff on the latest advancements in diabetes management.
That's a great idea, Dr. Mihiraa. Our staff could benefit from updated information on the latest treatment options and best practices.
Exactly. I can cover topics such as new medications, insulin pump therapy, and the importance of patient education. I believe this will enhance our team's knowledge and skills in managing diabetes patients.
That would be very helpful. When do you think would be a good time to schedule the lecture?
How about next week on Wednesday afternoon? We can arrange a convenient time slot that doesn't interfere with the staff's workload.
That sounds perfect. I'll coordinate with the nursing team and ensure that everyone is available, Dr. Mihiraa.
Great. We can also discuss any specific questions or concerns the staff may have beforehand. I want to ensure that the lecture is informative and relevant to their daily practice.
Now look at question 51. You hear a cardiologist called Mihiraa talking to a patient. Now read the question.
Mr. Paul, the pacemaker insertion was a success. The device is now functioning properly and regulating your heart rhythm.
That's great news, Dr. Mihiraa. I'm feeling much better already.
It's important to follow some precautions to ensure the optimal functioning of your pacemaker. Avoid strong magnetic fields, as they can interfere with the device. Also, inform your doctor about any new symptoms or changes in your condition.
Will I need to get regular checkups?
Yes, you'll need to schedule regular follow-up appointments with your cardiologist. We'll monitor the pacemaker's function and make any necessary adjustments.
I'm concerned about the battery life of the pacemaker. How long will it last?
Pacemaker batteries typically last around 5 to 10 years. When the battery starts to wear out, we'll need to replace it. The procedure is usually less invasive than the initial implantation.
I'm also worried about the risks associated with the pacemaker.
While the risks are minimal, it's important to be aware of potential complications, such as infection, bleeding, or device malfunction. However, with proper care and regular follow-ups, these risks are significantly reduced. Now look at question 52. You hear a nurse called Mihiraa talking to a patient's family. Now read the question. Mr. and Mrs. Paul, it's important to understand Mr. George's medication regimen. He's taking multiple medications for his heart condition and diabetes.
We're trying our best to keep track of all his medications, Mihiraa, but it's sometimes confusing.
I understand. It can be overwhelming. Let's review his medication list together and ensure you understand the purpose of each medication and the correct dosage.
We're also concerned about potential side effects. How can we recognize if he's experiencing any adverse reactions?
It's important to be aware of common side effects, such as dizziness, nausea, or changes in appetite. If you notice any unusual symptoms, please don't hesitate to contact us.
Can you recommend a medication organizer to help us keep track of his medications, Mihiraa?
Absolutely. A pill organizer can be a helpful tool. We can provide you with some options.
We're also worried about the cost of his medications. Are there any programs that can help with the expenses?
I can check with our social worker to see if there are any financial assistance programs available. We want to ensure that Mr. George has access to the necessary medications without undue financial burden. Now look at question 53. You hear a dermatologist called Mihiraa taking a lecture. Now read the question. Blackheads are a common skin condition caused by clogged pores. They occur when oil and dead skin cells build up and become trapped in the pores, creating a dark plug.
Mihiraa, is there anything I can do to prevent blackheads?
Yes, there are several steps you can take. First, gentle cleansing is essential to remove excess oil and dirt. Avoid harsh scrubs that can irritate the skin. Second, consider using a non-comedogenic moisturizer to keep your skin hydrated without clogging pores. Third, limit your use of makeup, especially oil-based products.
I've tried using over-the-counter acne products, but they haven't helped much.
Some over-the-counter products can be effective, but it's important to choose the right ones. Look for products containing salicylic acid or benzoyl peroxide. However, if your blackheads are severe or persistent, you may need to consult a dermatologist for further treatment.
Are there any procedures to remove blackheads, Mihiraa?
Yes, there are professional treatments such as cum-done extraction and chemical peels. These procedures can help clear blackheads and improve the overall appearance of your skin.
Now look at question 54. You hear a GP called Mihiraa talking to a patient. Now read the question.
Congratulations, Mrs. Peter, on your pregnancy. It's important to discuss your epilepsy management during this time.
Thank you, doctor. I'm excited but also a bit nervous. I've heard that epilepsy can affect pregnancy.
It's true that epilepsy can pose some risks during pregnancy. However, with proper management, you can have a healthy pregnancy and baby.
What are the potential risks?
The risk of seizures may increase during pregnancy, especially in the first trimester. It's important to take your anti-epileptic medication as prescribed and monitor your condition closely.
Are there any medications I should avoid?
Some anti-epileptic medications may not be safe during pregnancy. We'll need to review your current medication and make any necessary adjustments.
I'm also concerned about the impact of epilepsy on the baby.
While the risk of birth defects is slightly increased in women with epilepsy, with proper management and prenatal care, the risk can be minimized. Regular prenatal checkups and monitoring are essential. Now look at question 55. You hear a pharmacist called Mihiraa talking to a patient. Now read the question. Mr. Peter, I'm prescribing you codeine for pain relief. It's important to follow the dosage instructions carefully.
Okay, Mihiraa, I will. I've heard that codeine can be addictive. Is that true?
While codeine is an opioid, the risk of addiction is lower compared to stronger opioids. However, it's important to use it as directed and avoid long-term use.
I'm also concerned about potential side effects.
Common side effects include drowsiness, constipation, and nausea. If you experience any severe side effects, such as difficulty breathing or unusual drowsiness, contact me immediately.
I'll be sure to do that, Mihiraa. How long should I take this medication?
Your doctor will determine the appropriate duration of treatment based on your symptoms. It's important to follow the prescribed course and not stop taking it abruptly. Now look at question 56. You hear a physiotherapist called Mihiraa talking to a patient. Now read the question. Mr. Peter, before we begin your physiotherapy sessions, I want to discuss some potential risks associated with the treatment.
Sure, go ahead, Mihiraa.
While physiotherapy is generally safe, there's a small risk of discomfort or soreness during or after the sessions. It's also possible to experience temporary muscle soreness or fatigue.
Is there a risk of injury?
While injuries are uncommon, there's a slight chance of overexertion or straining muscles if the exercises are done incorrectly. That's why it's important to follow my instructions carefully and listen to your body.
What if I experience pain during the session?
If you feel any pain, please let me know immediately. We can adjust the exercises or take a break as needed.
Is there a risk of making my condition worse, Mihiraa?
In rare cases, improper physiotherapy techniques or excessive exertion could potentially worsen your condition. However, with proper guidance and adherence to the treatment plan, the risks are minimal.
Now look at question 57. You hear a nursing manager called Mihiraa conducting a morning meeting. Now read the question.
Good morning, team. I'm excited to announce that we'll be replacing the bedside switches in all patient rooms with a new, upgraded model.
That's great news, Mihiraa. What are the new features?
The new switches are designed to be more user-friendly and intuitive. They have larger buttons and clearer labeling, making them easier for patients to use. Additionally, they are equipped with a call button that directly connects to the nursing station.
That's fantastic. This will improve patient satisfaction and reduce the risk of falls.
Exactly. Patients will have better control over their environment and can easily call for assistance if needed. We'll also be providing training to our staff on how to use the new switches effectively.
Will there be any changes to the emergency call system, Mihiraa?
No, the emergency call system will remain unchanged. The new bedside switches will complement the existing system and provide patients with additional options for calling for help. Now look at question 58. You hear a nurse called Mihiraa talking to a junior nursing staff. Now read the question. Liza, today we're going to discuss the proper insertion and care of subcutaneous cannulas. These devices are essential for administering medications and fluids to patients.
I understand, Mihiraa. I've seen them used before, but I'm not sure about the correct technique.
The key to successful insertion is to identify a suitable site, clean the area, and insert the cannula at the correct angle. Always refer to the manufacturer's instructions for specific guidelines.
What are some common complications associated with subcutaneous cannulas?
The most common complications include infiltration, where the fluid leaks into the surrounding tissue, and phlebitis, which is inflammation of the vein. It's important to monitor the insertion site for any signs of redness, swelling, or tenderness.
How often should the cannula be changed, Mihiraa?
The frequency of changes depends on the type of cannula and the patient's condition. Generally, they should be changed every 72 hours or sooner if there are signs of complications. Now look at question 59. You hear a dentist called Mihiraa talking to a dietitian. Now read the question. Mihiraa, I'm concerned about Mr. Peter's swallowing difficulties. He's had a recent stroke, and his swallowing seems to be impaired.
I understand. Swallowing problems can be a significant challenge after a stroke. We can work together to develop a plan to address his needs.
I've referred him to a speech therapist for a swallowing evaluation. In the meantime, I'd like to discuss dietary modifications that might help.
Absolutely. We can adjust his diet to ensure it's easy to swallow and nutritious. We can recommend pureed foods, thickened liquids, and small, frequent meals.
That's a good idea. I'm also concerned about his risk of aspiration. Are there any precautions we should take?
Yes, it's important to position him upright during meals to reduce the risk of aspiration. We can also recommend specific swallowing techniques to improve his swallowing function.
Thank you for your advice, Mihiraa. I'll coordinate with the speech therapist and ensure that Mr. Peter receives the necessary support. Now look at question 60. You hear a nurse called Mihiraa talking to a physician. Now read the question. Dr. Paul, I'm concerned about Mr. George's breathing. He seems to be having difficulty breathing, and I've noticed a wheezing sound.
That's concerning. Can you describe the wheezing sound in more detail, Mihiraa?
It's a high-pitched whistling sound, especially during exhalation. It's getting worse over time.
Wheezing is often a sign of airway obstruction. It could be due to several factors, such as asthma, bronchitis, or a foreign object in the airway.
I've checked his medical history, and he doesn't have a history of asthma or bronchitis. Could it be related to his recent chest X-ray?
It's possible. Let's review the chest X-ray and consider other potential causes. We might need to order a pulmonary function test to assess his lung function.
I'll inform Mr. George about the need for further testing. I'm concerned about his comfort level. Should we administer oxygen?
Let's monitor his oxygen saturation levels, Mihiraa. If they drop below 90%, we can start supplemental oxygen. It's important to keep him comfortable and manage his symptoms until we can determine the underlying cause.